Ladies and gentlemen, aging nails, what can we do? First, we have to define aging nails. There is biological aging, extrinsic aging, exogenous damage, wear and tear, and they may all occur together. And in fact, they really are additive. We are used to compare nails with hair. But nails have no cyclical growth. They are not hormone dependent. There is no alopecia-like nail loss, and there's no nail graying. And when we look at this table, we can see that pigmentation increases, especially in people with skin of color with age, in contrast to graying hair. The thickness of the nails often increases distally. The number of nails remains stable. And infections are, in fact, much more frequent in the elderly. The nail is part of the digital tip, which is made up of bone, tendons, ligaments, joints, soft tissue, vessels, and nerves. And in between is the nail unit. What we can see here in this anatomical preparation, the nail really covers the dorsal aspect of the tip of the digit. And this is very nicely seen in this magnetic resonance microscopy image. And we can compare this highly sophisticated technique with the anatomical preparation. So what's the function of the nails, which is very important when it comes to aging? The nails protect the finger and toe tips. They enhance digital pad sensation. They are very versatile tools. They are important for defense, and of course, they have an aesthetic function. With aging, there is a slower growth rate due to decreased metabolic rate, diminished blood supply, less physical activity, and often also due to polypharmacy. If we want to correct this, we have to speed up the nail growth rate, particularly by increasing physical activity. There is a decrease of nail growth by 1/3 from the third to the ninth decade. We can accelerate nail growth by more physical activity and maybe also by biotin, zinc, iron, calcium, vitamin E, antioxidants. And, well, we can maybe delete the question mark from azoles because they were really shown to increase the nail growth rate. With age, the growth rate is even slower in smokers and in subjects with peripheral arterial disease. What can we do? Stop smoking and improve arterial circulation. Slow-growing nails become more brittle, develop splits, lose their shine and transparency. We can improve this by nail buffing and polishing to increase the nail shine. And here we have a clinical example of such a nail. The slower growth rate may result in thinner fingernails, fragile nails, dull nails. And we can improve this again by physical activity. And important, keep the nails dry. Again, question mark with all the vitamins and essential elements. And here we have a typical nail in a 63-year-old man. We see there is no surface shine, and we have this longitudinal ridging of the nail. The slower growth rate itself may result in thicker toenails, discoloration, and loss of transparency. If we improve foot mechanics, we can also improve the nail appearance. And here we have a 62-year-old woman who used nail buffing for her toenails. In contrast, here we have a 65-year-old woman with very thick and dull toenails. The slower growth in age leads to larger onychocytes and often also to onycholysis. Again, vitamins like biotin, zinc, iron, calcium, vitamin E may be helpful. Azoles may increase the growth rate. And important, especially for women, reduce moisture contact. Slow-growing nails are longer exposed to harmful physical and chemical hazards. They become brittle, the shine is lost, and the transparency also. So apply nail oil or balm regularly, particularly before moisture contact. And question maybe antioxidants are helpful. And again, 63-year-old men with longitudinal ridging, and we can improve this by nail buffing. These longitudinal ridges are a sign of aging. Well, most women do not like to hear this, so I call them a sign of maturation. But in fact, they really often start after the age of 30. Nail buffering and nail oils are often very helpful. And again, here we see clinical examples, and we also see a functional melanonychia in such a nail. And again, a 63-year-old man. And here you can see these white lines. This man had an 8-week period of high fever. Actinic elastosis of the nail bed is very rare since the nail plate is an effective sun shield. And of course, you cannot see it clinically, but sometimes as a chance observation, you can see it in the histopathology slide. And here we see this line whose significance is really not clear. And we also know that nail psoriasis in the elderly is often stubbornly resistant to most treatments. And so effective systemic and topical psoriasis treatment also improves the nails. And here we have a clinical example of an 83-year-old female patient. And this is a 70-year-old woman with nail psoriasis. And again, longitudinal ridging in a 62-year-old patient. And this is an 82-year-old man with very characteristic longitudinal striations. Longitudinal ridging may be aggravated by the development of beads that are arranged in a longitudinal manner. Again, polishing and buffering may help. And Pertinax bodies are a special appearance that can also be improved cosmetically by polishing, buffering, nail varnish. If the nail is splitting distally, a nail fortifier may be helpful. And here we see that there is a longitudinal ridging, but also longitudinal surface defects in a 63-year-old man. If a patient develops a platonychia or even chondronychia with age, try iron substitution and maybe also biotin and zinc. Zinc improves iron uptake in the intestines. Nail dystrophy is, however, often occurring without any detectable cause. For toenails, look for venous insufficiency if it's they're treated, and also improve the patient's mobility. Lymphedema and lymphatic obstruction may be the cause of nail dystrophy. So treat lymphedema and lymphatic obstruction, and again, improve the patient's mobility. This is an 80-year-old man with a yellow nail syndrome, which is a very complex syndrome a triad of yellow nails that hardly grow anymore, lymphedema of the uh, distal parts of the extremities, and chronic sinobronchitis. With aging, the susceptibility to fungal infection increases proportionately. Onychomycosis in old age are particularly recalcitrant to all treatments. They are often associated with foot abnormalities. So discuss the condition in detail and treat the patient. Do not only treat the onychomycosis. This will often be disappointing. And we also know that nail thickness is inversely related to the cure rate. So what you can see here is a very, very thick nail. So the treatment options are very limited. So onychomycosis of the elderly is always difficult to treat. So, and particularly rule out multimorbidity, think of possible drug interaction, consider combination treatment, and also consider, if not when the patient takes several drugs, if it's not better to just use topical treatment, even though this will not cure the onychomycosis. So combined treatment with nail thinning, atraumatic nail avulsion, topical and systemic antifungals are recommended if possible. Sometimes, as you see here, in a 79-year-old woman with moccasin type tinea and diabetes, so here really a nail avulsion is necessary. And probably in the 60-year-old man weighing 160 kilograms, you can do whatever you want. You will never cure this patient's onychomycosis. Chronic paronychia is not rare in old age. It may be due to contact allergy, fungal infection, and bacterial infection. So always confirm the etiopathogenesis, treat according to the proven etiology, and inform the patient about manicure without nail damage. And here we have a clinical example of chronic paronychia. This is also often associated with Pseudomonas infection or colonization. When conservative treatment fails, partial nail avulsion is a valuable option. Surgical reduction of grossly thickened proximal nail wall frequently helpful to improve cosmesis, and then we can have these clinical pictures, and the surgical reduction is a beveled excision of parts of the proximal nail fold. And this can also happen if people who have no knowledge of the nail do non-indicated surgery. Green nails, again, chronic Pseudomonas colonization. Look for predisposing factors, immunosuppression, and consider local and professional factors. So long-term systemic anti-Pseudomonas treatment, well, this is easily said, but difficult to do because Pseudomonas colonization always requires an onycholytic nail, and systemic antibiotics do not reach an onycholytic nail. And here we have a clinical example of a green nail. Long-standing ingrown nails may even lead to so-called harpoon nail, as you can see here, where the spicule of the nail pierces through the skin. And here we have another example of an ingrown nail, and then 6 weeks after the finalization of the lateral matrix horn. Overcurvature of fingernails is not so frequent, but it's usually associated with degenerative osteoarthritis of the distal interphalangeal joint with Hebden nodes, and acute inflammation may lead to transverse overcurvature. If this is really acute inflammation, it's reversible and can be treated topically with non-steroidal anti-inflammatory agents or also systemically. However, such a condition is not amenable to a treatment with any sort of pills. But this lady was treated with an antibiotic, and the swelling of the distal interphalangeal joint receded, and the nail became normal again. Overcurvature of the toenails is a very frequent condition. Most cases are symmetrical and have a genetic basis. The asymmetric cases are usually associated with foot deformation. There may be a hemi overcurvature, as in this case, which really invites surgery. And this is then how it looks after medial selective matrix horn finalization. However, nail deformation may also be due to subungual tumors, as like here, due to a submatrix exostosis. And please avoid surgery if you do not really know what you treat. So in overcurvature of the toenails, the central part of the distal nail gets heaped up and pulls the nail bed epithelium up, causing subungual papillomatosis and hyperkeratosis. It's amazing how rarely this is infected by fungi. However, a traction osteophyte develops on the distal dorsal tuft, and maybe nail abnormalities render this nail more susceptible to infection. Faulty biomechanics of the feet are often associated with acquired overcurvature. We can try to correct this surgically by removing the lateral matrix horn, extirpation of the distal dorsal exophyte, and flattening of the nail plate. And this is the schematic illustration of the technique that we have developed. Onychogryposis is another extremely chronic condition, which is due to a combination of pathologies. The nail grows like a ram's horn, becomes extremely thick, and often turns upward. It's mainly seen in debilitated or immobile persons who can no longer take care of their toenails. Foot deformation is almost always found in association. So this is a mild case, and this is a case of an elderly patient who could not reach her toenails. So it's a horrible condition and also very often painful to the patient. And this is a single onychogryposis in an 81-year-old man after a trauma to the second toe. So toenails are often transversally overcurved. Frequently, there's a sharp bend of the lateral quarter or fifth of the hallux nail impinging on the lateral groove and causing painful hyperkeratosis in the groove, which is called onychophosis. So soften the nail and smoothen the nail edge may be helpful. So as you can see here in this 59-year-old patient. So are there really remedies against nail aging? Vitamins are not effective. Antioxidants are not effective. Hormones are not effective. Essential elements are not effective. Amino acids are not effective. Silica and fluoride not effective. And there's a big question mark about biotin. So nail care in the elderly is important. Keep the nails dry, keep them short, keep them clean, use emollients and nail oil, and do not overdo manicure. Nails become more prone to a variety of conditions, some of which may be amenable to surgery, like these malignant tumors. In chronic venous insufficiency, the nails may be markedly thickened and discolored or crumbly and yellow. So surgery of the varicose veins may be important. And nail dystrophy, even without any detectable cause, is not rare in the elderly. There is a number of conditions that we associated with faulty biomechanics of the feet. Subungular or also called onychoclavus, correct the footwear and soften the nail plate. And we often have a medial rotation of the big toe and the lateral rotation of the fifth toe, which is actually the result of a spread foot. Subungular hematoma is often due to friction in shoes and to chronic repeated trauma. And finally, there is a syndrome called AGNUS, asymmetric gait nail unit syndrome, which was claimed to be the most frequent nail abnormality in the world, often misdiagnosed as fungal infection. And here we have such an example. We can see there's an hallux valgus, there's a hallux valgus interphalangeus, there's a medial rotation of the toe, there is a slight hallux erectus, increasing friction on the distal lateral edge of the nail plate, leading to onycholysis. Thank you very much for your attention.